Hi, I am Dr. Zakir Hussain, Senior ENT Consultant. The topic for today is Rhinitis caeseosa. This is a drawn diagram, and I would like to explain to you that normally there is a lot of secretions here, and it has got a smooth flow, and all the secretions from the nasal, from the sinuses and the nasal cavity, it flows posteriorly, comes to the throat, and it is swallowed to the stomach. But if there is any obstruction of that side, usually one side in this case, if any obstruction of that side, usually because of sinusitis or polyp degeneration or any foreign body like that, there will be a calcium deposit in the center, and around that there will be a lot of secretions accumulating in that part. That forms a rhinolith. So rhinolith means because of the obstruction of the nasal passage, it leads to stagnation of the secretions and results in the formation of a caseous material in the nasal cavity, usually the causes which I have already mentioned. Now, the common complaints of the patient, they say that they have one-sided nasal block, and of late the others complain that there's bad smell coming from that side, from that particular nasal cavity, nasal nostril. And when we examine, especially with an endoscope, we can see the cheesy material. I show you one nasal endoscopy, you will understand better. So this is a normal side. So I am doing an endoscopy here. This is the normal side. You can say it is patent, it is clear, nasal cavity is very good. So if you see the other side, you can see some cheesy material, and it is stuck in the inferior turbinate and in the upper part also. So I found it difficult to take it out in the OPD in this particular. The patient was young also, so she has to be taken to the operation theatre. So that is the material which you see, cheesy material. Now coming to investigation, if you want to do an investigation, we can start by doing an X-ray. So in that we can get a good idea. If suppose this has been going on for a long time and the patient also complains of facial pain and headache, and so we can do a CT scan of the sinuses other than the X-ray. So the CT scan will show the rhinolith clearly, and if there is any, same time if you have any rhinosinusitis. If there is a pus collection, I would like to take a nasal swab to come to know which bacteria and which antibiotic can be given against that. So this is a CT scan of a patient where you can see the rhinitis caeseosa, rhinolith clearly. Coming to the treatment, if the rhinolith happen to be small, and the patient is cooperative, it can be easily taken out in the OPD itself. But in case the patient is not cooperative and the rhinolith is stuck and it is involving it is in the meatus or somewhere, we are not able to remove the OPD. In that case, we need to take the patient to the operation theatre, and then under sedation, we could like to remove the whole thing and clean the whole thing, and that will solve the problem. Now, the whole procedure in the operation theatre, it takes approximately 15 minutes to 30 minutes. And we have to take the patient to the theatre with all the due precaution which has to be taken so that the patient is fit to be taken to the operation theatre. So this is how we manage a case of rhinitis caeseosa. Thank you so much.